Come in.
Hello, my name is Beth. I'm going to be your student nurse today. How are you doing?
Good.
Can you go ahead and confirm your name and date of birth for me?
David Schumer, 11063.
I'm going to go ahead and check that with your name tag. If that's all right, if I can touch your wrist.
I'm sorry, I'm confused.
Okay, thank you. And I'm going to confirm that with my paperwork here. I do see David Schumer, 110 of 63. Okay, so they would I totally in a urinary catheter. Have you ever had that done before?
No.
Alright, so what that is where we're going to be placing a tube of your urethra to collect urine. It's going to make it easier for you to go to the bathroom, as well as keep track of your intake and output. Okay?
Okay.
Do you have any questions?
No.
Alright, so I'm going to go ahead and put on my gloves and go ahead and clean your private area. If it's alright if I can lift up your drape.
Yes.
Okay. So I'm going to lift the drape for my patient. I've already asked that it's all right. And I'm going to go ahead and inspect his penis and glands and make sure it's all clean and ready to go for the catheter. Okay, so I'm going to go ahead and get a new rag. How are you doing?
Good.
But anytime you feel uncomfortable, you just let me know and we'll go ahead and stop, alright?
Okay.
Okay, so I'm going to go ahead and cover you back up for a few minutes while I prepare my sterile field, okay?
Okay.
Do you have any questions right now?
No.
Alright. Alright, so I'm going to go ahead and make some room here. I'm going to open my package and my catheter. We're going to be using a 16 French today. And this is going to be my trash bag. Okay. And I'm going to open my sterile field away from me. First, and then the sides. And the other side. We have 1 inch of a border, although this is not considered a sterile field. Okay. So I do have a drape here I'm going to use to catch the liquids. It's not going to be considered sterile underneath my patient though. So I'm going to go ahead and place this underneath here to go ahead and catch any urine that will be excreted during the procedure. Is it okay if you lift your leg for me?
Yes.
And then the other side. Okay. And then I'm going to go ahead and put on my sterile gloves and prepare all my sterile equipment. So I'm going to use this area to do my sterile gloves so I have some more space. Okay. So I did touch my patient, so I'm going to do a hand hygiene thing. Just make sure it's all clean before I put on my sterile gloves.
Oh.
Okay. So now my hands are sterile. I'm gonna go back over to my field. Okay. I am going to go ahead and prepare everything before I touch my patient so that I can remain sterile while I'm inside of my box here.
Most of these are seeds.
I just gotta look for a camera. So, I mean, this is sterile, right? If you stay
Everything inside here is still sterile. I'm just preparing everything so that before I go to my patient, everything will be ready for me to use. So we are using alcohol instead of betadine in this instance because of the mannequin. And I'm going to go ahead and check my balloon to make sure that it is working order. Staying inside my box, because outside of my box is not sterile. I'm going to go ahead and check my balloon here to make sure that it is in working order before placing it inside my patient. So I'm inserting 10 mLs of sterile water and watching my balloon inflate. I'm inserting all 10 mLs to make sure that the balloon is strong enough to handle the amount of fluid that I will be pushing into the patient. Okay, so it is still intact. I'm going to go ahead and deflate the balloon. And everything I have here is still considered sterile. Okay, I'm going to leave my syringe attached. Place this back inside my sterile field. And grab my lube. Open my lube before I touch my patient. Because after I touch my patient, I will no longer be sterile.
Like, why would it
Okay. Now that I have everything all set up, I'm going to go ahead and return to my patient and tell him that I'm ready to go and that we're going to get started. Okay, so David, I do have my sterile field all prepared. Are you ready to get started?
Yes.
Okay, are you feeling comfortable?
Yes.
Okay. If it's all right with you, I'm going to go ahead and lift up your drape and expose you, all right?
Okay.
Okay, so before I lift up his drape, I'm going to move my sterile field from the inside of the box closer to my patient. And now this hand is no longer going to be sterile, it's going to be clean for my patient. Okay.
And is
I'm going to go ahead and place my drape over my patient. This is still sterile. And then I'm going to go ahead and grab the penis with my clean hands and use the betadine alcohol swabs to drain the patient's glands. Alright? Okay, so I'm going to go ahead and clean around your penis. It's going to be a little bit cold, alright?
Okay.
Okay, here we go. Okay, and one more. It's still going to be a little bit cold. Okay. All right, so we're ready to go ahead and get started. I'm going to go ahead and lube the tube, and we're going to be prepared to insert the tube into your urethra. Are you still all right?
Yes.
Yeah. So that's the one you would do.
And I can go ahead and touch this plastic with my clean hand because it's going to be thrown away, and try to keep my catheter here sterile with my sterile hand. Alright, I'm going to go ahead and lube up my catheter 5 to 7 inches for a male.
I like go shopping, you know, my boyfriend went for grocery shopping and I like sleeping.
Okay, so we got lube all the way up the tube, 5 to 7 inches.
But I like the ones with no sugar.
And I'm going to go ahead and tell my patient to bear down and take a deep breath and release. And on release, we'll be inserting the catheter. So patient, if you could go ahead and take a deep breath, David. I'm going to prepare to insert the catheter, all right? Okay, so deep breath in. And go ahead and release your deep breath. Here we go. At any moment you're not doing all right, you let me know. Okay. So I do see urine being released. So that means that I'm going to push it an extra inch further. Okay. Still have not touched the penis with my sterile hand. We're still sterile here. And I'm going to go ahead and inflate my balloon. Are you doing all right, David?
Yes.
Okay, so I'm going to inflate my balloon. Okay, and because I'm not at the right area inside my patient, inside my mannequin here, it's not going to let me inflate. So I'm going to try to push a little bit more. Okay, and I'm going to try to inflate the balloon one more time. Okay, so we're still not at the right spot, but because this is a mannequin, I'm going to say that the balloon was inflated and that all 10 mLs of sterile water are inside the balloon in the patient. Okay. Alright, so I'm going to go ahead and remove this from my sterile field. And I no longer need to be sterile, so I'm going to grab the bag with my clean hand so that I can hang it on my patient's bed. So we're going to go ahead and start collecting urine. Okay, how are you feeling, David?
Good.
Good. I'm going to go ahead and make some documentation here and prepare to leave the room, all right?
Okay.
I'm going to remove my sterile gloves. And I'm going to take my documentation and then leave the room. Okay, I'll be back to check on you in a little bit. I'm going to go ahead and on you and cover you back up with your privacy grid, okay? All right. I'll be back in a little bit to check on you, okay?
Okay.
Enter call light. And I'm putting your bed back down to the lowest position. And then exit your room. Providing privacy. Okay. Next, I'm going to go ahead and remove the catheter from my patient. I am going to go get some more gloves before I remove the catheter, okay? I'll be right back.
That was bad. Great. I'll be laughing at that video.
So Dr. G, it was great to have you in the video here. I'm going to laugh at that later too. All right, I'm going to go back into my patient's room and remove the catheter, okay? Knock, knock, knock.
Come in.
Hi, my name is Beth. I'm going to be removing your catheter today. Can you go ahead and confirm your name and date of birth for me, please?
David Schumer, 11063.
Thank you. Let me go ahead and check your wristband if that's all right. All right, thank you. And I'm going to check with my record also. David Schumer, 11063. All right, so David, today we're going to be removing your catheter. Are you excited to get that out?
Yes.
Awesome. And all we're going to need to do is take a deep breath in, and on release, I'm going to go ahead and remove the tubing. Do you have any questions before we get started?
No.
Okay, I'm going to go ahead and get prepared to remove that, all right?
Okay.
So this is all out of the way. It was removed at the end of entering it. I discarded all of the materials. I'm going to go ahead and put on my gloves. These don't have to be sterile because we're removing this from the patient. Got some squeaky gloves here today. All right, David, I'm going to go ahead and expose you. Is that all right?
Yes.
All right, thank you. And I'm going to go ahead and deflate the balloon and remove the catheter from my patient's leg. It was taped to his leg. Remove the balloons by deflating, pulling back on the syringe just to make sure I have all the liquid out of it, sterile water out of here before I remove it from my patient. Okay. All right, David, if you could go ahead and prepare to take a deep breath for me. And as soon as you exhale, I'm going to remove the catheter, okay?
Okay.
Okay, so deep breath in and out. All right, how are you doing?
Good.
Good. Let me just go ahead and clean off the area here, inspect it before I let you go to make sure everything is still doing all right, okay? So I have another clean towel. Just gonna go ahead and check them out. Make sure I see no bleeding. All right, you're looking good down there, David. Okay, so I'm gonna go ahead and cover you back up. Do you have any questions or concerns before I let you go?
No.
All right, I'm gonna go ahead and do some documentation stating that you tolerated the procedure well and that I see no blood in the urethra. And here's your call line in case you need us. And we'll be back to check on you in a little bit, all right?
Okay.
I'm going to go ahead and lower your bed back down. All right, you have a great day, David.
Thank you.
Privacy and documentation.